You are watching the DocTalk show.
So, Dr. Mukisha, now coming to cervical cancer treatment specifically, what treatments are available? Is this disease, it causes lots of deaths, but can it be treated anyway?
As we go to treatment, we cannot reiterate enough that screening and prevention is the cornerstone for this management. You have to prevent you from actually acquiring this cancer, if we can, as much as possible. Yes.
They said that prevention, is it treatment? Prevention is better than cure.
Yes.
Yes. So
this is just the actual definition of do not get it. If you get it, we really have a very small window within which to play with management options. So they are not as encouraging. And as we've said, majority of our clients come in very late in the disease. And that is over 80. So it is a very silent illness. People don't get to know. And many of our wives and girls, they really don't, they're not so proactive with the screening. Majority of girls have actually not had the screening done. So until the symptoms come way later into their reproductive years or even way beyond, do we get to, oh, now it has come, and so what do we get to do? So if it is very early in the stages, maybe stage 1 and maybe a little bit of stage 2, surgery can help. And in this case, we try and remove the whole uterus and the whole cervix, all of it, cervix, uterus, and maybe many other organs around the womb and the cervix, trying to make sure that we are thorough with the removal of all the cells. But that is also too early within the stage. But like we said, many come way beyond with other treatments, especially at Cancer Institute. They've made use of chemotherapy, use drugs, radiotherapy to try and shrink the mass and relieve symptoms. And also mix, do surgery, do some chemotherapy, radiotherapy, but none of these also really gives us very good outcomes. These are just to buy us time. Like, we are trying to prolong the lives of these people, the lives of the culprits around. So they are not curative in any way, and we are saying, try to prevent us from getting here if we can. Yeah. So, and the managements are palliative, really. We try. Are you in pain? Do you get bed sores? Many tend not to move. Can you urinate? How do you pass stool when the blockage is blocked? Majority of things are just palliative in nature.
So what you're trying to bring out is the early stages with surgery you can cure the condition.
Yeah.
In the early stages.
Yeah, exactly.
But the problem comes in the late stages, where the majority of the patients you see, I don't know if this is only in Uganda or worldwide, when they present in the late stage, the treatment options are very limited. Surgery doesn't work as well. Radiotherapy, no. The use of drugs may not work. So it's basically reducing the impact of the disease, but without really a clear treatment.
If it's advanced, what they try to do is just improve your quality of life.
Okay.
But it is not curative in any way.
It's not curative. Yes. So the key message is we should attempt to catch this disease early enough, and before it becomes too advanced.
Yeah, before it comes.
And you told us ways in which one can detect this disease early. That is the screening methods using the pap smear. We emphasize all women above 21 years should have a pap smear done every 3 years, in addition to other screening tests to check if there might be abnormal cells that can be treated early enough to prevent this condition called cervical cancer. Is there any other method that can prevent cervical cancer?
Currently, there's vaccination of young girls against HPV. It starts at around the age of 9 to 13 in Uganda, up to the age of 19. Worldwide, it's up to the age of 26. So what happens is you give these girls 2 to 3 vaccines, and what it's supposed to do is to prevent them from actually getting this infection. Okay. It gives you a life protection, like you're protected over
a lifelong protection.
Yes, lifelong protection.
And it's available to young girls.
Yes.
Why is it in such a young age, 9 to
you want to read
19? Why do they say that this age group?
You want to capture them before they get exposed.
Before the exposure to that
Because
infection.
we are assuming that between the ages of 9 and 13, you're not sexually active. Okay, so you want to catch them before they become exposed later in life.
So the goal of vaccination is, before the person is exposed to a disease, you give a vaccine
to prevent them from.
So the way vaccines work is they help build they build the body's immune system so that in the event that the actual infection occurs, the body can quickly eradicate it. So I wondered, so Dr. Mugisha, if this vaccine is only available to young girls, what about those who are beyond the age of 19? Will the vaccine still work for them, for the women who are maybe 30 years, 40 years?
Maybe just to correct, we are not saying it's just for girls. Even boys ideally should be vaccinated because they are the transmitters of actually, they're the vector. They move with the virus and give it. So they should, but various bodies sat and said, if we are going to curb it, let us try and focus on the lady who actually suffers from this from the cervical cancer illnesses. Not that it doesn't have an effect on the men, but penile cancer is really, really rare. We don't usually see those other symptomatic presentations in men. So the focus has been on the women, and we prefer before the exposure. So it should be before you actually acquire the virus. That's when it is important. That's when it is beneficial. It is productive. If a young girl has been sexually exposed at 16, 17 years, giving her the virus is not protective in any way.
You mean giving the vaccine?
Yeah, giving the vaccine. So it is prudent that you tell them this is supposed to prevent, but if you have acquired this in any prior interactions, it is not going to be so much helpful. So here and about, you will see many women or girls, 30 years, 32 years, who will walk up to you. Why can't I get this vaccination, now? So the 26 is an arbitrary age that was, it's a worldwide age. We believe by 26, majority of the women have really been exposed. And it should even be given, maybe if you've had one sexual partner, you've been so faithful, and we are saying you have not had that, you have not acquired it, so maybe either you've had, that one sexual partner for quite some time, or you've been celibate for over a prolonged period. That's when vaccination in later ages might make a little bit of sense, but it is usually a misuse of the drug if someone has already had sexual partner.
So the problem will come in if it's a lady above the age of 20, 21. You won't be able to tell whether she has been exposed to the virus or not.
It is hard to tell.
It's hard to tell. Yeah. That's why you would restrict the vaccination to the younger group, where at least you're almost certain they've not yet commenced their sexual debuts, so most likely they won't be infected with the virus.
Exactly.
Okay. So just remember the vaccines are available on the national immunization schedule. These vaccines are available to all young girls aged 9 to 19 years of age. So if you are a caretaker of a young girl who is in this age group, probably school going, and she has not yet been vaccinated against cervical cancer, please take her to the nearest hospital and she receives this vaccine. It's completely free of charge, and it's, as we know, prevention is one of the most effective ways of preventing disease. So if you can prevent yourself from getting the virus, you prevent yourself from getting the cervical cancer. I think that should be the main point which people should understand. And also, on top of vaccination, we encourage women, all women above the age of 21, go for periodic checks for cervical cancer. Our experts have explained there are different methods available: the pap smear, the tests for the virus itself, or colposcopy. All these tests are available in the hospitals. Please go and get yourself checked at periodic intervals. Every 3 years is recommended in order to catch this disease and treat it as early as possible. Thank you for watching the DocTalk show. We thank our guests, Dr. Mugisha and Dr. Osinguzi, for demystifying this huge disease called cervical cancer. And we hope the message has reached home, has reached your heart, and that you take the message very seriously and prevent cancer. Thank you for watching and have a great evening.